Welcome to Chicken and Life. I'm Adrienne, the turquoise lady, and today I'm going to be talking about processing trauma. So the question that I started with was, is there a difference between processing trauma and just running over the trauma again and again in our minds? And it turns out that yes, there is. So there's like non-productive processing, which really isn't processing at all. And then there's productive processing where we're working through things, and I'll get more to that later. Okay, so a lot of my information comes from the Behavior Therapy Journal, the American Psychological Association, and the Department of Health and Human Services, which is a .gov website. So there's different types of trauma. There's emotional, physical, and sexual trauma. Abuse can come in the form of emotional, verbal, physical, and sexual abuse. So what is not processing? Rumination. Rumination is repetitive thoughts about trauma, and unfortunately the consequences are that we can have intrusive thoughts that don't allow us to be paying attention to other things going on in our lives, re-experiencing the trauma, prolonged distress. Since we're not really working through it, we're just prolonging how long that it hurts us. It maintains the post-traumatic stress disorder that might come along with it and the symptoms that go along with it. It can lead to anger and emotional venting that can bring those symptoms of post-traumatic stress disorder up. So that one's really interesting because we think that we're working through it, but really we're just getting ourselves more and more excited. At one point, a couple of years ago, I decided to look into scream therapy. I want to say that this was like something that kind of was hanging around in the 90s, and it turned out to be something that just caused us to manage our emotions in a bad way. Like we get used to then and practice at just getting pissed off about everything and not working through it and resolving it. So another thing that can be a not processing is overgeneralization. So it can make it difficult to distinguish what is safe in our world or with other people versus what is dangerous, resulting in us having like an absolutist belief system. So I can't trust anybody. Eventually they're all going to betray me. The world is a dangerous place. All men are going to hurt me. Just like really general statements that can't possibly be true. So it also can lead to hypervigilance, which is when people are always on alert, looking out for the danger that might be around the corner. That's hypervigilance. Emotional reactivity is another thing that can come from overgeneralization. So we're so like ready for things to go wrong that any little thing that even kind of sort of is annoying, we just blow up over. It can also lead to more internalizing and externalizing symptoms. So what internalizing symptoms are when we have some of the symptoms of anxiety or depression. Externalizing symptoms are things where we're acting out by lying, cheating, stealing, vandalizing, setting things on fire, being verbally hurtful to other people around us or people that we encounter, like, you know, when we're at stores or restaurants, and substance using. Those are all external symptoms. We're enacting on the world around us. So avoidance, that is another form of not processing our trauma. And avoidance does work, but only on a temporary basis, okay? If we use it for too long, instead of working through our trauma and the pain we've experienced around it, it increases our symptoms related to that trauma. So it increases our anxiety, stress, and fears. It increases our use of alcohol and substances. It can increase depression, eating disorders, self-injury, and suicide. It can lead to intrusive thoughts, nightmares, flashbacks, rumination, and overgeneralization. So avoidance is really bad. It leads to the other stuff I was talking about, and it impairs our ability to put things in perspective. The whole goal is to work through things, put them in perspective, challenge our erroneous beliefs, the beliefs that we have all wrong, like all men can't be trusted. It prevents finding a new way of looking at what happened, because sometimes we put it away, and that means we don't get to work through why that might have happened in the first place. So what is productive processing? It's talking about it. In my practice as a dietitian, I remember that there was somebody that would come to me and just talk about what happened to him during his service. Talk about it. And I just let him. And he told me that his mental health provider had encouraged him to just talk about it as much as he could. And the reason why is because every time you say it, every time you hear yourself say it, every time you see somebody else's reaction to it, it helps you kind of put things in perspective a little bit more. Sometimes you even get feedback from the other person. Sometimes that's good and sometimes that's bad. So I just want to throw that out there. All right. So when we can articulate what's happened in an event and how we feel about it, we give it context, we give it perspective, and it allows us to give it meaning. Okay. So creating a healthy distance, this is called decentering. So creating a healthy distance from the event. That happened then. I am safe now. It is not happening here and now to me. It helps us disconnect from those non-productive processing cycles that I was talking about. It helps us tolerate negative emotions because they're over there. It helps us put it in perspective. It helps us find meaning in the experience and gain insight about it. Some of the treatments that mental health providers use to do that, cognitive behavioral therapy, that is basically working to change our thinking, or basically unhelpful thinking patterns, okay? Cognitive processing therapy is a subtype of the cognitive behavioral therapy, and it helps by challenging and modifying our beliefs around our trauma. Cognitive therapy is another one that is derived from cognitive behavioral therapy, and with that one, it changes the way we view the trauma. And then another one that the articles talked about were prolonged exposure therapy, which is an intervention in cognitive behavioral therapy that teaches people to slowly reassess traumatic memories, feelings, and situations by either describing the event in detail or by visiting places or people related to the event. And then sometimes medications like antidepressants or anti-anxiety medications are used as well. Those studies have found that the talk therapies are more effective than medications. And the reason why is because the medication only works as long as you're taking the medication. But these mental health tools are something that we can use to process everything, not just that event, things that happen in our lives. It gives us a new way of kind of looking at the world and processing the world around us. I just want to acknowledge that it is not easy processing trauma. Whether it's an event that happened one time and that's it, or if it's something that kept happening over time, it is really hard to process trauma. And if you're having trouble doing it, if you're kind of in that avoidance, overgeneralization, rumination phase, then maybe that's where you need to be right now, because you're not ready. You're not weird or weak or wrong if you're not processing your trauma right now. When you're ready, please look for a mental health provider. I am not qualified to help with these things, but a mental health provider can help hold your hand, and so it's less scary as you walk through this. Thank you so much for listening. I'm Adrienne the Turquoise Lady, and you've been listening to Chicken and Life. Please like and subscribe to my channel, and have a wonderful day.